Hello, and welcome to another Medical Director Minute. I'm your host, Dr. Brian Everett. Today, we'll be discussing something we've been seeing in the emergency department lately. Croup, also known as laryngotracheal bronchitis. Try saying that 5 times fast. Let's start with a scenario. You're dispatched for breathing problem. You arrive to find a 2-year-old female. The mom tells you the child has been sick for about 2 days now, and today start having this weird sounding cough and loud breathing sounds. Croup is caused by a viral illness. Parainfluenza is the most common virus, but RSV can also lead to croupy cough. RSV tends to be the inciting virus this year, but it's important to note influenza, also known as the flu, can also cause croup. Croup tends to be more common in the fall and winter, and the fact we are seeing it now is weird. Children aged 6 months to 3 years are most commonly affected, and incidents tend to peak around age 2. Children will tend to present after 1 to 3 days of upper respiratory infection or URI symptoms. This may include a running nose, nasal congestion, and sometimes a fever. What sets croup apart from other viral respiratory infections is the stridor and barking cough. Let's take a listen to what this sounds like. The stridor can be variable. You may only hear it with activity or agitation. It's important to remember we need to make sure something more serious is not causing the stridor. First, ask about the possibility of a foreign body. Kids can swallow all kinds of things. Asking about what they were doing before the stridor started is essential. History of playing with small toys or coins before the stridor started may clue you into a possible foreign body. A child with stridor and drooling is a true emergency. You should allow the child to be kept in a relaxed and comfortable position and get to the emergency department as quickly as possible. This might be a sign of epiglottitis, which we can discuss in a later medical director minute. So what is happening in the airway of a child with croup? The trachea is narrowed due to inflammation. Therefore, our treatment is focused on reversing the inflammation. The first and most accessible treatment is humidified air. During the winter months, this may be as easily as taking the child outside. You can also allow the child to take a few deep breaths in front of an open freezer to help to reduce their symptoms. If you hear stridor on exam, you can give nebulized epinephrine. This is prepared by taking 3 milliliters of 1 to 100,000 epinephrine and putting it in the bowl of the nebulizer, but it works pretty well. If you have Decadron, you can give the IV formulation orally. The dose is 0.6 milligrams per kilogram. If you don't have Decadron, don't worry, it takes about 6 hours to work. Therefore, you can wait until the child gets to the hospital. Hypoxia is rare with this condition. Provide oxygen if needed. Albuterol is not recommended as it can lead to worsening edema via vasodilation. To review, stridor at rest needs nebulized epinephrine. Use 1 to 100,000 epinephrine. Decadron is indicated, but can wait to the hospital if you're not able to give it. If the patient is drooling because they cannot swallow their secretions, you must recognize that this is an emergency. Properly transport the patient to the emergency room, sitting in a position of comfort. Thank you guys for watching. Remember to like the video, subscribe to the channel for weekly pearls of EMS care, and share with your EMS friends. Have a great day out there and stay safe.